The UNM Cancer Center has just made a big breakthrough in finding, I should say, treatment for people with melanoma. And this could be really big news for people who are dealing with that right now. Here with more on the new development and what it could mean for treatment is Dr. Montaser Shaheen. And we're glad to have you this morning.
Thank you.
Thanks for coming in. So let's talk about what you've discovered. I'm curious what this really means, the treatment and how it could help people.
We have been at UNM Cancer Center, we have been part of national team that combined 2 immune drugs for the treatment of metastatic melanoma. We have seen remarkable activity, much better than historical numbers as far as what we achieved before with chemotherapy.
I was going to ask how it compares to chemotherapy.
So the efficacy, the response rate, which we define as good shrinkage in metastatic melanoma, we have seen about 60% of patients get a remarkable shrinkage with this combined immunotherapy. Another 20% get stable disease, what we call stable disease, which translates into clinical benefit. So in total, about 80% of patients benefit, compared to 10–20% with chemotherapy.
So the comparison there really is, does it depend on the individual? I mean, what kind of results they might see with chemotherapy versus this one? Or, have you done studies in that area yet?
Well, most patients benefit from this chemotherapy, as I mentioned, about 80%. The other thing, the benefit tends to be durable with the chemotherapy, with the immune therapy. While with chemotherapy, one would expect benefit to last for a few months. With immune therapy, it could last for years. That's the other exciting aspect of the immune therapy.
Now, how is this taken? Is it an oral drug?
There are 2 IV drugs. They're given IV every 2 to 3 weeks.
Okay, so that's how it does it. So what does this mean? This has got to, when we say it's a big breakthrough, this could really revolutionize how people who suffer from this end up being treated and really recover in the end. It's got to be pretty exciting.
It's very exciting. I mean, the original trial that demonstrated safety of the combination, now we have long-term data with it, and 80% of patients are alive at 2 years, versus with chemotherapy, one would expect about 10% with metastatic melanoma to be alive at 2 years. So,
and when you say metastatic, you mean? Is it
like melanoma spread to other organs, liver, lung, bone.
So that becomes a more serious case in that case, right? Unless you catch it much earlier. So in the end, how long did it take you to develop something like this? How long have you been working with our other oncologists on it? Well,
these immune drugs, one of them was approved few years ago. The other one, in isolation, was approved just recently. We did the original trials on the ipilimumab, the first drug, and we discovered through times that it's better to combine them, and so this story has been going on for years now.
I'm wondering if people at home I know who may know someone who's going through this or are having this issue themselves are wondering how soon this may be available. Is it available now?
Well, the 2 drugs are approved by FDA for melanoma, but in isolation, so you could use each drug alone. The combination, the trial we just discussed, is presented to FDA. So FDA is going to say most likely yes, hopefully, in September.
Okay, so it's coming up in just a few months now. How critical of a role did UNM's Cancer Center play in all of this, in the development of this?
Well, we have been part of a national team. We enrolled patients into this trial. Of the 5 patients, New Mexican patients who went into the trial in the fall of 2013, I'm glad to say like 4 are still alive and in remission. So we're very excited, for the outcome of our patients.
So it's been going on a while now to kind of get this going, and we're looking forward to the development in September. Where can people get more information if they're curious?
UNMcancercenter.com, so there's details about the...
Fascinating. KRQE.com. We've got a link there too to the UNM Cancer Center. There's the address right on the screen. But Dr. Shaheen is on the cutting edge of some interesting developments there. We hope that very much that there's some success down the road. Sounds like there already is. So
great news for our cancer patients.
Yeah, absolutely. Very good news. Thank you, Doctor. Appreciate it. We'll be right back after this. Headlines are next. Don't go anywhere.